Introduction. Welcome to today's lecture on the exciting field of medical nanotechnology and reproductive medicine. In this course, we will explore the various applications of nanotechnology that have revolutionized the way we diagnose and treat reproductive health issues. From targeted drug delivery to real-time fertility monitoring, nanotechnology has opened up new avenues in reproductive healthcare. We will also discuss the ethical considerations associated with the use of nanotechnology in this field. So, let's dive into the fascinating world of nanotechnology and reproductive medicine. Nanotechnology, as the name suggests, deals with structures and processes at the nanoscale, typically ranging from 1 to 100 nanometers. In reproductive medicine, nanotechnology has emerged as a promising field for enhancing diagnostic and therapeutic approaches. The ability to manipulate matter at such a small scale brings about numerous advantages, including increased drug efficacy, targeted delivery, and improved precision in reproductive health interventions. One of the key advantages of nanotechnology in reproductive medicine is the ability to develop nanoparticles as targeted drug delivery carriers. These nanoparticles can be engineered to specifically target reproductive organs or tissues, allowing for enhanced drug concentration at the intended site of action while minimizing off-target effects. This targeted drug delivery approach has significantly improved the efficacy and therapeutic outcomes of various reproductive treatments. Nanoparticles, such as liposomes, polymeric nanoparticles, and lipid nanoparticles, are frequently employed as drug delivery carriers in reproductive medicine. These nanocarriers offer several advantages over conventional drug delivery systems. By encapsulating therapeutic agents within the nanoparticle, the drugs can be protected from degradation in the body and can reach their target site intact. Additionally, the nanocarrier's surface can be modified with ligands or antibodies to enhance their specificity towards reproductive tissues or cells. For example, in the treatment of ovarian cancer, paclitaxel-loaded liposomes have been developed to selectively deliver the chemotherapeutic agent to cancer cells while sparing healthy tissues. This approach not only improves the efficacy of the drug but also reduces its side effects. Similarly, in the field of contraception, nanoparticles can be engineered to release contraceptive hormones in a controlled manner, providing long-acting and highly effective birth control options. Another area where nanotechnology has made significant contributions to reproductive medicine is in the development of nanosensors for real-time fertility monitoring. Traditional methods of monitoring fertility, such as urine or blood tests, have limitations in terms of accuracy and convenience. Nanosensors offer the potential for continuous and non-invasive monitoring of key reproductive biomarkers, such as hormone levels or ovulation. Nanosensors can be designed to detect and quantify specific molecules or changes in physical properties associated with fertility. For example, graphene-based nanosensors have been developed to monitor changes in the electrical conductivity of cervical mucus, which reflects the hormonal changes during the menstrual cycle. This real-time monitoring allows for better prediction of fertile windows, thus aiding in family planning or optimizing the success of assisted reproductive techniques. Tissue engineering is the creation of functional tissues or organs for transplantation or repair. Nanotechnology has advanced this field, especially in reproductive organs and tissues. One challenge is creating blood vessels to support engineered tissues. Nanostructured scaffolds made from biocompatible materials provide a 3D environment for cells to grow and differentiate. These scaffolds can be precisely designed and include growth factors to promote tissue regeneration. For instance, in cases of uterine factor infertility, nanostructured scaffolds with patient-specific cells have shown promise in rebuilding the uterine wall. The scaffold's nanoarchitecture supports cell adhesion, nutrient transport, and tissue regeneration. Assisted reproductive techniques, ART, such as in vitro fertilization, IVF, have helped countless couples struggling with infertility to conceive. However, ART still faces challenges, including low success rates and high treatment costs. Nanotechnology has emerged as a powerful tool in improving the outcomes of ART procedures. One of the critical steps in IVF is the selection of the most viable embryo for implantation. Traditional selection methods rely on manual assessment, which can be subjective and inaccurate. With the integration of nanotechnology, microfluidic devices embedded with nanoscale features can be used to sort and analyze embryos based on their morphological and physiological characteristics. This high-throughput, automated approach not only improves embryo selection but also reduces the time and cost associated with the procedure. Furthermore, nanotechnology-based approaches have also been explored to improve sperm quality and function. For instance, magnetic nanoparticles can be used to isolate high-quality sperm from semen samples, enhancing the success rates of ART procedures. In summary, nanocarriers offer a promising solution for efficient gene therapy in reproductive medicine. These vehicles protect therapeutic genes, enhance cellular uptake, and ensure their delivery to the nucleus for gene expression. In the field of male infertility, nanocarriers can be delivered directly to the testes to correct genetic abnormalities and restore fertility. This advancement in nanotechnology holds great potential for treating genetic disorders and overcoming infertility issues caused by genetic abnormalities in reproductive medicine. Male infertility affects a significant percentage of couples struggling to conceive. Nanotechnology has offered new possibilities for the accurate diagnosis and effective treatment of male infertility. One prominent application of nanotechnology in male infertility diagnosis is the development of nanosensors for semen analysis. These nanosensors can detect and quantify various parameters related to sperm quality, including motility, morphology, and DNA fragmentation. By providing more detailed information about sperm parameters, nanosensors allow for a more accurate assessment of male fertility and aid in identifying appropriate treatment strategies. In terms of treatment, nanotechnology-based approaches have shown promise in improving sperm quality and function. Nanoparticles can be loaded with antioxidants or other therapeutic agents to protect sperm cells from oxidative stress or enhance their motility. Additionally, nanotechnology can be employed to deliver small interfering RNA, siRNA, or other gene-modulating agents to sperm cells, addressing specific genetic or epigenetic causes of male infertility. Female infertility can arise due to various factors, including hormonal imbalances, structural abnormalities, or age-related factors. Nanotechnology has opened up new avenues for the precise diagnosis and targeted treatment of female infertility. Nanoparticles can be used as carriers for hormonal therapies, ensuring controlled release and enhanced efficacy. By specifically targeting reproductive tissues or cells, nanocarriers can deliver therapeutic hormones with improved precision, reducing systemic side effects. Additionally, the surface modifications of nanocarriers can enable their selective uptake by specific cell types, allowing for targeted drug delivery to dysfunctional reproductive tissues. Furthermore, nanotechnology has facilitated the development of non-invasive diagnostic techniques for female infertility. For example, nanosensors integrated into tampons or devices worn internally can detect changes in pH, inflammatory markers, or hormonal levels in the vaginal or cervical environment. These real-time monitoring systems provide valuable information about the woman's reproductive health and aid in diagnosing underlying causes of infertility. In addition to helping couples struggling with infertility, nanotechnology has also made significant contributions to contraception. The development of nanomaterials has led to the creation of innovative birth control options with improved efficacy and reduced side effects. Nanotechnology-based contraceptive methods offer several advantages, including prolonged duration of action, reduced dosage requirements, and increased contraceptive effectiveness. Nanoparticles can be engineered to release contraceptive hormones in a controlled manner, overcoming the limitations of traditional contraceptive methods. Examples of such nanomaterials include biodegradable polymer nanoparticles loaded with contraceptive hormones, which can provide contraception for an extended period, ranging from weeks to months. Moreover, nanotechnology has enabled the development of non-hormonal contraceptive options. For instance, nanoscale barrier coatings can be applied to condoms or intrauterine devices, IUDs, enhancing their efficacy by preventing the entry of pathogens or sperm cells. These nanostructured coatings can also reduce side effects associated with traditional barrier methods. Nanotechnology has brought about significant advancements in prenatal diagnosis and therapy, enabling early detection of fetal abnormalities and targeted intervention when necessary. These advancements have the potential to improve the management of high-risk pregnancies and optimize prenatal care. One of the key applications of nanotechnology in prenatal diagnosis is the development of non-invasive prenatal tests, NIPT. These tests utilize nanoscale platforms, such as biochips or microfluidic devices, to analyze the fetal genetic material present in the mother's blood. By detecting specific genetic markers associated with chromosomal abnormalities or genetic disorders, NIPT offers a safe and reliable alternative to invasive prenatal diagnostic procedures. Nanotechnology has also facilitated targeted drug delivery to the developing fetus, enabling prenatal therapy. Nanocarriers loaded with therapeutic agents can be administered to the mother, facilitating their transport across the placental barrier to reach the fetus. This targeted approach minimizes maternal exposure to potentially harmful drugs while maximizing the therapeutic effect on the developing fetus. Nanorobotics, an emerging field at the intersection of nanotechnology and robotics, holds great promise in the field of reproductive medicine. Nanorobots, typically composed of nanoscale materials, can be designed to perform specific tasks at the cellular or molecular level, offering unprecedented control and precision. In reproductive medicine, nanorobots have the potential to revolutionize diagnostic and therapeutic interventions. For instance, nanorobots can be employed for targeted drug delivery to reproductive tissues, enabling precise dosage and localized treatment. These miniature robots can navigate through the complex maze of the human body, delivering therapeutic agents directly to the intended site and reducing off-target effects. Furthermore, nanorobots can be equipped with sensors to monitor physiological parameters or detect abnormalities in reproductive tissues. By providing real-time feedback, these nanoscale sensors can aid in identifying early signs of disease or optimizing treatment outcomes. Although still in the experimental stage, nanorobotics holds tremendous potential for transforming the field of reproductive medicine. To promote the responsible use of nanotechnology in reproductive medicine, transparency and communication between healthcare professionals and patients are crucial. Patients should be provided with accurate and understandable information regarding the benefits, risks, and potential limitations of nanotechnology-based interventions, allowing them to make informed decisions about their reproductive healthcare. Lastly, ongoing ethical discussions and collaborations between scientists, medical professionals, policymakers, and patient advocacy groups are essential to ensure that the integration of nanotechnology in reproductive medicine aligns with societal values, respects individual autonomy, and promotes justice and fairness in healthcare delivery. In conclusion, nanotechnology has significantly impacted reproductive medicine, revolutionizing diagnosis, treatment, and prevention of reproductive health issues. Its applications, such as targeted drug delivery and real-time fertility monitoring, offer promising advancements. Nonetheless, ethical concerns must be carefully addressed to ensure responsible and fair utilization of these technologies. As the field progresses, the future of reproductive medicine appears bright with nanotechnology playing a central role. Thank you for your participation in this informative lecture on nanotechnology and reproductive medicine. I trust it has offered you valuable insights into this fascinating domain.